Should people, just regular people, no signs, no symptoms, nothing, how often should they get tested?
So on the program, one of the things that we do is that we screen individuals before we get them tested. There's a screening tool that shows us the level of risk that that individual has exposed himself or herself to. And so if the risk is high and the person gets tested, we ask the person to come back in 3 months. If the person is at high risk, in other words, is sexually active, probably not using a condom, has multiple sexual partners, and at that point that we test, if the person comes out negative, we ask you come back in 3 months. But then we counsel you, say, this is the lifestyle that you must live if you want to prevent yourself from getting infected. And we ask them to come back in 3 months because the tests that we use is an antibody test. And so sometimes an individual may be infected, but the antibody test will not pick it up because the virus is still replicating at that point in time. And so given some time more, the person will come back and we'll get the person tested. And